I get a lot of consults for anxiety and tachycardia. Now there are some things that cause tachycardia that are not anxiety, and we try to rule those out. You wear a Holter monitor, you get an echogram and a stress test, and you get a whole workup. But eventually, it comes back that those things could be all normal, and then that's when we start suspecting anxiety. There's a component of anxiety that's an underlying anxiety that you don't normally feel like you're an anxious person, or you don't even realize you are, but there's this, just your mind is racing at night. You can't make this go away, and your chest sometimes feels tight from it. And we've checked all the other stuff, and you don't have it. So one trigger that makes me think of this is when patients say, at night when I lay down in bed to sleep, I can't sleep, and I start feeling that squeezing chest pain, and my heart starts racing, and I can't go to bed. That's usually a trigger for me to think, okay, maybe this is actually anxiety um, rather than anything else. So definitely look out for those kind of clues. You can treat this many different ways. You can have their primary doctor treat it, or usually we use a medication like Celexa, citalopram, which is generic and it works really, really well for this. For whatever reason, also helps like calm down a lot of the catecholamines and adrenaline response that can happen from anxiety. But you also want to blunt that too. Something like metoprolol works very, very well at lowering your heart rate without reducing blood pressure. So it works really well in these conditions. You want to get that anxiety blunted with the citalopram, and then the tachycardia or racing heart as well with something like metoprolol to keep that at bay, because it's a cycle. You notice your heart racing at night, gives you a little bit of anxiety about it. Then anxiety releases catecholamines or adrenaline, which makes your heart race even more, which makes you think about it more now, which triggers it again. It's like a cycle. It's hard to break. Sometimes you got to break it at both spots. You got to stop the anxiety and stop the tachycardia and hope that that wipes it out and makes it go away. If you like this video, there's a whole bunch more for you.